Hello, my name is Siti Alia Binti Sharum. My metric card number is D202211022396. Today I'm going to present to you a psychologist disorder called Intermittent Explosive Disorder, or known as IED. So, have anyone heard what IED is? IED is actually happening among the society quite frequently actually. So how to know IED is, let me introduce you the meaning first. Intermittent explosive disorder, or IED, is a behavior where it involves repeated and sudden bouts of impulsive, aggressive, violent behavior or angry verbal outbursts. In short, IED is a reactions from someone that are too extreme for the situations. The reactions could be road rage, domestic abuse, throwing or breaking objects. It is dangerous because they can harm relationships and cause problems at work or school. They also can result in problems with the law. IED is a long-term condition that can go on for years, but the severity of the outburst may lessen with age. So now that we know what IED is, let's dig into the prevalence. The prevalence is kelaziman yang berlaku dalam kalangan masyarakat, among the society. So let's see the prevalence of IED among the society. 1 year prevalence data for intermittent explosive disorder in the United States is about 2.7%. Intermittent explosive disorder is more prevalent among younger individuals, which are younger than 35 to 40 years old, compared with older individuals, which are older than 50 years old, and individuals who have a high school education or less. So in short, the prevalence of IED happens among younger people over older people. So now we know that what prevalence of IED among society. Now let's dig into the signs. Why sign is so important is that because we need to knowledge ourselves whether a person actually have IED or not, or because sometimes the sign could also help us to diagnose a person if they have IED or they have other symptoms such as bipolar disorder, because bipolar disorder also can relate to IED sign as well. Now let's dig into the signs of intermittent explosive disorder. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, the sign could be first, verbal aggression, which are in the form of temper tantrums, tirades, verbal arguments or fights, or any physical aggression toward property, animals or other individuals, occurring twice weekly on average for a period of 3 months. It does not result in destruction of property and physical injury to animals or others. Second, the behavioral outburst involving damage or destruction of property, or physical assault involving physical injury against animals or others within a 12-month period. Third, the magnitude of aggressiveness expressed during the recurrent outburst is grossly out of proportion to the provocation or to any precipitating psychosocial stressors. And fourth, the recurrent aggressive outbursts are not premeditated. They are impulsive and or anger biased and are not committed to achieve some thinkable objective like money, power, or intimidation. And last, the recurrent aggressive outbursts cause either marked distress in an individual or impairment in occupational or interpersonal functioning, or are associated with financial or legal consequences. Other signs are chronological age at least 6 years or equivalent developmental level. And last, the recurrent aggressive outbursts are not better explained by another mental disorder such as major depression disorder, bipolar disorder, disruptive mood dysregulation personality disorder, psychotic disorder, antisocial personality disorder, borderline personality disorder, and are not attributable to another medical condition like trauma, Alzheimer's disease, or to physiological effects of substance like drug, abusive, or medications. However, for children aged 6 to 18 years old, aggressive behaviors that occurs as part of an adjustment disorder should not be considered for this diagnosis. Now that we already learned the sign, so we need also know the causes of the intermittent explosive disorder as well, because the causes help us to analyze why a person have IED. Let's get more of them. First causes are environmental. Individuals who grow up in families where explosive behavior and verbal and physical abuse were common issues. The children are more likely to have these same traits as they grow up. Next causes are genetic. First-degree relatives of individuals with intermittent explosive disorder are at increased risk for intermittent explosive disorder. The gene related to the tendency to react more easily to stress and may have passed down from parents to children. And third, physiological. Amygdala responses to anger stimulation during functional magnetic resonance imaging scanning are greater in individuals with intermittent explosive disorder compared with healthy individuals. Other than causes, we also should know the risk factors, because the risk factors are actually the main reasons of how IED can be triggered in someone. So what is risk factors? The first risk factors are history of physical abuse. The individual might be abused as a child, being bullied, or going through other painful events. They can raise the risk of having the intermittent explosive disorder. Second, history of other mental health conditions. Having antisocial personality disorder or borderline personality disorder may raise the risk of having intermittent explosive disorder. It also appears to be quite common with disruptive behaviors such as attention deficit hyperactive disorder, ADHD, history with substances use like alcohol and drugs. Other risk factors that can trigger the intermittent explosive disorder are unemployed, single and unmarried, lower levels of education, experiencing physical or sexual violence as a child. Now, after we knowledge ourselves about what the meaning of IED, the causes, the signs, and also the risk factors, we also need to knowledge the intervention that we have for the IED person. Intervention is perawatan, which are provided by the therapist, psychologist, or counselor. First intervention is talk therapy or psychotherapy. Cognitive behavioral therapy or CBT usually is the main therapy most therapists or psychologists use to treat IED. Therapists or psychologists help individuals to take a closer look at the thoughts of emotions. These are specific techniques that use in CBT for IED. Second intervention is medicine. Fluoxetine is a selective serotonin reuptake inhibitor or SSRI. It's a specific medicine used to treat intermittent explosive behavior or IED. Medicine can help to control the aggressive impulse. Generally, the therapist or psychologist will prescribe the following classes of medicine for IED individual. Now we almost at the end of my video. Before I end my video, I have an advocate message for the public. Now we at the end of my video, so I hope my video can help you understand what intermittent explosive disorder is, and I hope you also knowledge what IED, and in case you have any questions, regarding of IED, you can always ask the counselors or psychologists or any therapists you know. Okay, and yeah, that's all. And thank you for watching my video. Bye.